Dr. Cassandra Ramdath. Before we begin, thank you for being here with me virtually and agreeing to take part in sharing your expertise and evaluation with our Master of Public Administration and Leadership students here at the John Glenn College of Public Affairs at The Ohio State University. We spoke a bit before, and as you may know, our MPAL program is specifically designed for students that are mid-career and up professionals. And our curriculum is pretty much tailored towards strengthening their ability to lead their teams, organizations, and communities towards a better world. For our data models and evaluation course this year, I'm preparing a short set of videos with professionals who have been involved in program evaluation and can offer some unique insight into the work done in this area like yourself. So thanks for being willing to take part in this today. So could you introduce yourself, tell us a bit about your professional background, kind of who you are in this space?
Thank you, Dr. St. John. I am very excited to be here and share with you and your students a little bit about me and the work that I do. So thank you for thinking of me. As Dr. St. John said, my name is Cassandra Ramdath. I am the Director of Research and Evaluation at the Center for Innovations in Community Safety. We call ourselves KICS because that's quite a mouthful. And we are an academic research center affiliated with Georgetown Law. We do work that really focuses on community safety through training, technical assistance, research, and evaluation, with the goal of reducing the over-reliance on policing, as well as the harmful consequences that are often experienced by communities of color. So I completed my PhD at John Jay College of Criminal Justice with Dr. St. John. And most of my focus has been on the correctional population. I did my PhD examining traumatic brain injuries among young people that were detained in Rikers Island at the time. And have since been working to conduct research, mixed methods research in several areas, but all focused on harm reduction, the intersection between health and justice, and really focused on community wellness. And that encompasses a lot of different things like safety and health and racial equity. And so I am very much an applied researcher, and that means that I do research usually that is focused on creating tangible change through policy, through best practices, through working with stakeholders that are at all levels, working with the community members to really push for change. And I usually am a proponent of mixed methods. So I do everything with both both quantitative and qualitative. And I also try to focus on community engaged participatory action research. There's a lot of different ways we title that type of work, but essentially, I always try to engage the community that we're studying or the people that are involved in the things that we're studying to make sure that we're really trying to get it right and that we're not tunnel visioned as researchers, like just sticking with the literature and making sure that we are thinking clearly about what it is that we're trying to do in order to make change, that we're engaging the people that are going to be impacted by the change. So that's been sort of my trajectory into this world and my approach to the way that I do research.
That's amazing. I think we're going to learn a lot from you today in terms of kind of that ability to have these different partnerships, center different voices, balance different perspectives, I might imagine, as you're kind of describing the breadth of your work. But before we go there, I guess one of the areas we can jump into is, in your experience, can you describe one of the better process and or impact evaluations that you've been involved with, thinking about some of the strengths or areas of improvement just in your experience?
Yeah, I'll talk about an ongoing study that I'm leading right now. It is an evaluation of our ABLE program. So just very, very briefly, ABLE is, and it's not an internal evaluation because it's actually being implemented in San Francisco Police Department. So the ABLE program is meant to create a culture of active bystandership for police departments. And we're focused on peer intervention. So what that means is that officers who patrol together, for example, if they see their fellow officer escalating a situation or potentially about to make a mistake or engage in police misconduct, that they will jump in and prevent that from happening. And so this training program, it's being deployed nationwide, and it focuses on two main things. So one is establishing a culture where active bystandership is the norm. So I might expect that if I'm feeling kind of heated, that my officer is going to stop me and prevent me from doing the thing that I shouldn't be doing. And that's the culture, that it's normalized and it's not retaliated against. And this is a way of holding us accountable as police officers. And the other piece is the training, the actual skills-based training. So, the ABLE program isn't saying that every single time you see an officer about to do something that you like pull them off and get physically involved. There are a lot of different ways that you could redirect someone or distract them or step in or have a code word or different techniques that are going to be put in their toolbox for how to do this alongside the culture shift. So that's the ABLE program. We have been funded to evaluate this because, as I said, it's being deployed pretty quickly across the country, but there's no evidence of its efficacy as yet. And so it's really important for us to know, like, is this actually changing police misconduct and in what ways? So we are we are already starting an evaluation in the San Francisco Police Department, looking at both process evaluation components and doing an outcomes evaluation. So we're doing a randomized control trial, so an RCT, to look at the impact of ABLE on police misconduct. But we're also interested in racial disparities in police behavior because we know how important that is, and it is aligned very much with our mission. So we're also looking at implicit bias and implicit bias training in the police department. And so I'll get into a little bit more of that because it's part of our RCT design, which I would say is our biggest strength on this, is that it is an RCT in the sense that we're working really hard to control as much as we can, and we are randomizing our participants to the different groups. So we're really trying to minimize any external influences on the effect on being able to measure whether or not this program works. And the way we're doing that is through the RCT. So we have three groups. We have the first group is going to be getting ABLE only. The second group is going to be getting ABLE plus the implicit bias training. And the third is our control group. So they're not receiving any training until after all of our data collection is done. So we have the two treatments and the control group, and they're going to, go through the program, and we are going to see whether or not their behavior changes by looking at a lot of different things that are indicators of police misconduct, such as use of force, stops and the outcomes of the stops, seizures, officer-initiated complaints, community-initiated complaints, really just all the data that we can get to try to measure police behavior and see by the end of this, do those measures change based on who went through what program or not at all? And it doesn't necessarily have to be like a reduction, but it needs to be a shift, right? So what I mean by that is, police officers may not be using force anymore. Maybe they shifted to citations, and we see the racial disparities change. And that would be an outcome too, right? So we're looking at like reduction and shifts, like differences and change in behavior. And we're going to hopefully be able to capture that with the three different groups. The strength for this study, as I mentioned, is in the RCT, because we're going to randomly assign all the officers to one of the three groups, hopefully reducing any other biases that might come up otherwise, versus if you just said, like, all the officers that show up from this week are going to be ABLE training, and all of these officers that show up in week 2 are going to do this training. Like, there might be something biased about those groups that show up on those weeks. So what we're going to do is basically like mix it up and give everyone an equal chance at being in any group and randomizing them. That way we are addressing one of the limitations with research, right? When we do when we can't, oftentimes we can't just put random people in these studies, but that's what we are able to do because we have the whole of SFPD, all of their officers participating in this. I would say that is our
Wow.
biggest strength, being able to design it like this. And then the other strength I would say is this is also a community-based participatory action research study, which means that our goal is to really highlight the policing harms that are coming up in San Francisco and within the SFPD behaviors. And it's really important for us to be able to do that by ensuring that that we're centering the voices of the people that are most impacted. So we are doing this in two ways. We have a community advisory board, which involves people in the community in the San Francisco areas that are most policed, like heavily policed, and involve people like the demographics make up the groups that when we look at the data we know are most often harmed by the police. So they are actually going to be helping us design everything. They're going to help us decide what questions we should be asking. They're going to tell us, what does the data mean when we get it back? What should we do with this? What are the policies that should be implemented? They're going to help us disseminate the findings through local events. And the reason that I say this is a strength is because it's going to help us stay honest and it's going to help our validity, right? So when I say policing harms, I'm talking about what I know about police harms, which might be like use of force, or I don't know how it differs in San Francisco, especially for the people experiencing it. They're going to help us say, that's not what we talk about by police harm. When you say like, oh, there's a reduction in use of force, that doesn't mean they're still not out here harming us. What you need to look at is like
Right.
the body language or how many officers come up to one person. Like there's going to be other things that we miss. And to cover these blind spots, we need to make sure that for the sake of validity, that they're helping us define the measures, operationalize them, measure them, and even when we get the data, explain to us like what does it mean, what are we missing, and then get it back out into the community that's being impacted, not just end up in a publication or like going back to our funders to get more funding, but to make sure that the community is also benefiting from this research. The second piece of the community engagement method is that we are partnering with the local community-based organization to help us run semi-annual listening sessions. So community members are going to be invited to join us and talk about this study, and we're going to ask them what are their perceptions of the San Francisco Police Department, what are their experiences, what kinds of harm are they facing, how can we measure it, how can we capture it, and we're going to do it every January and July, and see how that's changing as our program is being rolled out, so that we're not just relying on administrative data, but we're also hearing from the community what their perceptions are and how that's changing over time. So I would say those are our two biggest strengths of using this type of design for our evaluation. And as for weaknesses, I would say it's always challenging to roll out an RCT, especially because we're not in a lab. We're not like in a sterile environment where everything can be just managed. And I'm just checking what we wrote down. We said that we were going to, oh yeah, so we said that we were going to randomize in SFPD by working groups. So all of the officers that patrolled one specific geographic area at from the 11 p.m. to the 3 a.m. shift. So that was how we were designing it, that, basically groups that patrol together would kind of be assigned so that we minimize spillover. So one of the risks of an RCT is that like this group is getting the training, but what if they talk to the people who are not getting the training and then there's contamination, meaning that now they know about this ABLE thing and they know that they might be watched for intervention, and it alters their behavior, right? So that is one of the weaknesses that we have, or limitations, I should say. And we thought we were addressing it by creating working groups that were people who patrol together. And then when we talked to SFPD, we found out that they change their assignments every day. Like who polices with each other, they change it. So there's no like clusters and working groups that's going to make it easy for us to contain the spillover. So I would say like one of the challenges when you design something like an RCT is like you have all of these unexpected things that come up with that you have to kind of figure out how to address and minimize, because you're never going to be able to do a study that's like completely like flawless, especially in social sciences. And so we have to be kind of ready for these issues and figure out how to address their impact or respond to their impact on the study's validity, reliability, replicability, especially if it's not as we initially intended for it to be. And then the last two small pieces on weakness is training fidelity. So this is always going to be an issue when you're doing evaluation, right? Like the program, the way it's designed, is it actually going to be implemented the way that the curriculum was developed and the way that each instructor developed? There's 1,500 SFPD officers. They're all going to be receiving training in sessions, but each one might be a little bit different. And so how do we measure the impact if each training might be like slightly different, or the instructor has a different personality or style? And so that's always a challenge as well that can be a weakness for us. So that's the importance of the process evaluation piece, right? So we're going to be observing a random selection of these sessions to try to get a better sense of if they are following the guidebook, if they are using all of the tools and the videos, and if they're doing role play the way it's meant to, because we need to capture that to really know, like, at the end of this, if we want to say that the program was effective, we have to know that like the program as it was designed is producing the outcome, not some variation or mishmash of the program. So I think treatment fidelity is also one of the not weaknesses, because we're trying to address it, but it's one of the limitations that we have to think about. And then the last piece I'll say, which I'm sure for everyone is not a surprise, but data. When we talk about police data, probably any data, but we are getting 5 years worth of policing data from multiple sources on things like use of force, which we know has been kind of crazy over the past few years in terms of whether or not it's documented, under what circumstances, is it allowed, is it not, is it unnecessary, is it necessary? So all of this data that we're getting is going to be messy. It's from different sources. It's going to have a lot of missing data. It's going to have multiple people were entering the data and they defined it differently. They thought about it differently. And so we expect that we're going to have a lot of data management that is going to limit our ability to say a lot about police behavior, just because a lot of this even is very scarce. So when you think about use of force, the frequency, at least which it's documented, it's not that often. Same thing with complaints. Like, even though there's an avenue to provide complaints against officers, how many people are really going through the formal process of putting in a complaint? So our data is going to be limited, and it's not going to represent the whole scope of the issue. And this is probably true for most legal system data, that it's missing, it's messy. And so we're going to have to figure out ways to deal with kind of creating proxies for that. So maybe that's there's a lot of statistical techniques that we could use to like impute data, or for us, that's also why we're triangulating with lots of different data. So we have a lot of different sources. We're also doing surveys. We're also doing observations. So to the extent that you can, it's really important to have a lot of different data collection sources when you're dealing with messy data.
Wow, this is amazing on so many fronts. The robustness of this evaluation, the process and the impact side, the attention to detail. I think you touch on a lot of points that we try to discuss as a class, whether in discussion forums or some of the lectures and lessons. I don't even know where to begin, but like the RCT, right, being this golden standard, but even that having its own limitations that you now have to think about. I think that is particularly interesting, being paired with a program that's being implemented and evaluated kind of simultaneously. So there's probably this CQI, or continuous quality improvement aspect to it, where things probably will get updated throughout the life of the program, which is beautiful. I think one thing that resonated with me there personally had to do with that contamination component of RCTs, where it's like, hey, we trained this one group to do this one specific item, and we want it to stay here, so the treatment, right, which is in this training, doesn't go everywhere else. And unless you have what you described, like folks who only work together in these spaces, or a large enough amount of staff members, that's kind of hard to do. So it's beautiful to see that you all kind of had that set up in this evaluation. I think some other items that stood out to me in this is that action-oriented element of the study in terms of having community members' voices centered in throughout the entire evaluation, but also that also kind of highlighting focus of your evaluation, which is focusing on some of the disparities and inequities that can come from policing, and knowing that the San Francisco Police Department is on board and in support and providing the official data and the whole nine there, which kind of lends itself to a question that naturally comes up in my mind is, how did you all kind of foster that relationship with the police department to say, hey, like, we want to look at these things together?
Yeah, there's a couple things that had to happen. I mean, first of all, when we were doing this, when we were designing it, we had to think about where was going to have a big enough sample size. So obviously there are a lot of police departments. Many of them are very small. And if we know we want to have 3 different treatment groups, we had to think about size. So we needed at least over 1,000 officers. So we started with some of the biggest PDs that we could think of. Some, and also they couldn't have already gone through ABLE, because obviously we would want to roll out ABLE in a controlled way. So many police departments in the country have already gotten ABLE. So we started there. Who doesn't have ABLE? Who's big enough to even think about an RCT? And then thirdly, which is where at least for us, we benefit. One of our co-faculty directors, Christy Lopez, she is basically like an expert in this field, and she, over the past 25 years, has developed a lot of strong relationships with the chiefs of different police departments. And so she had a few conversations with different chiefs and got them on board. And then we ended up kind of leaning towards San Francisco, because they were also very much interested in reform and wanting to be better, wanting to bring accountability. And so we initially started off very rigid, like size, no ABLE, and then it came down to like who knows who. It's really important to have influential leaders on your team that can help get you into these places, because relationships are important in this work. And she just built so much good faith with a lot of the chiefs that she's now passing on to us. And that's the reason we were able to get in with them and have their buy-in and their support and the ability to do this together.
That's amazing. Yeah, especially within a kind of hierarchical type of agency like that, the top-down kind of component definitely helps there. That's a beautiful thing. I've had some work in close proximity to different criminal justice agencies, and that's always a thing. It's like, who are you? What are you doing here? Why should we listen to you? Why do we want to work with you? And having that buy-in from the top helps, and it's always a continuous thing to have that relationship. I do have a question here, and for each person I've been speaking with, having these conversations and formal interviews, there's a unique question tailored towards kind of your expertise and some of the things I kind of know behind the scenes you have the capes to kind of unpack. And the question I have for you is, in evaluation work or research more broadly, how do you navigate the competing interests of various groups that may want to see certain outcomes, or groups that might want to avoid examining and highlighting certain elements that might be revealed through the research? Like, how do you navigate that?
Yeah, that's a great question. That is like 90% of what I do, because it's like always managing different perspectives in this work. So in my I guess over my trajectory, I've always been working with diverse stakeholder groups, including like the departments of corrections and incarcerated people, and trying to bring those groups to come to some common ground, and then the courts and the police and the communities. And so I have done a lot of this work. And I'll use an example that we're of a project that we're doing right now because I think it kind of drives the point home with bringing diverse stakeholders together. So we are working in the HVIP space, that's hospital-based violence intervention programs. These are violence intervention programs that are housed in the hospitals in DC with the goal of treating gunshot victims when they come into the hospital. So physically treat them, make sure they're stable, but then also provide wraparound services to hopefully prevent re-injury, fatality, as well as getting them the supports that they need because they've been shot and it's a long road to recovery. Sometimes they need to be housed in a different place because it's no longer safe for them to be in that community. And so the whole program operates on being able to treat like the person when they come in to the hospital. So we at KICS have been brought in because we also learned that when a victim comes into the hospital, oftentimes the police will also come in because they want to investigate the crime, right? So here's where we see like this competing interests and priorities come in. Someone gets shot, they come into the hospital, the HFIP program wants to treat this person physically, help them recover, and then help them go back and live a healthy life and thrive in a new community, most likely. Police want to come in and investigate. They want to do interviews. They want to collect property. They want to do talk to the family members. And so we see these competing interests at a very tense point in time for everybody that's involved. Police are under the pressure to get that gun off the street, get that person off the street. Hospitals under pressure to save this life and provide services to this person. That person is under pressure because they are being asked questions by the doctors, by the police. And so it's this very challenging situation for everybody that's involved, all under this shared umbrella of community safety, right? So it's like everybody's trying to do this thing to be safe and healthy and protect other people, and you have the police doing it in their way, which is we need to come in and investigate and figure out how we can go back into the community, prevent a retaliatory shooting, get the gun off the street, get that person off the street, and then the police and then the hospitals are like, yes, we are preventing gun violence by trying to make sure this person is safe and healthy and recovered, and that everybody else in their group can also try to like move forward in a different way. So you see, everybody is kind of moving towards the same thing, but they're doing it in a different way. And so through this project, we created a steering committee of 20 plus people with all of these people at the table. So I will say that like my biggest lesson learned in all of this is bring everybody to the table. So we have a steering committee of 20 plus people. That includes high up MPD, the Metropolitan Police Department, captains, that are in the investigation division. They're the detectives and the captains. We have the trauma surgeons, the medical directors, we have the nurses, we have community members, we have victims of violence, we have lawyers, and we have everybody that meets with us every month. And they talk about these issues, like what is it when you, like we've asked, for example, like when MPD comes in and someone has just got shot, what is it that you need? What is it that is going to help you? And how can we get that without you needing to be, for example, at the foot of the bed when somebody just got shot? Because the nurses and the surgeons will say, when you guys do that, it's stopping that person from being honest with us about the care we need to provide, because they're viewing you as an extension of us at the hospital, and we are trying to provide trauma-informed care, which is really hard to do with an officer in this room right now. And so like this sharing, right? This sharing of like, this is what's going on for us, and this is what's going on for us, and trying to find common ground has been really, really successful for us. So we have helped them create new hospital policies that are going to be paralleled by the MPD general order that they're going to create, to figure out how they can work together when MPD needs to be in the hospital with these trauma surgeons, and figure out where we can push and pull. And we've been able to create policies, forms, processes, create points of contact for people to get the information that they need and share it. And the way that we've been able to do this was having all these different perspectives at the table, but having them talk to one another, right? A lot of times policies and research, like it's all done in silos. So you have the researchers doing research, they'll share their findings. Then you have the lawyers writing the policies and they'll create something that's then dropped on the hospital or the police officers. But by having everybody in conversation, it's more effective because people are bought into the process. They feel like they can share what their daily challenges are because they're the ones on the ground doing the work, and that they can explain why what is happening right now doesn't work. So we've had community members push back on MPD in these meetings and say that you're treating every single victim that comes in like a suspect. And that's not what we want for the healthcare system. And the police will sometimes push back and say that person has a phone that can tell us the location of where the shooting happened. We need that for the investigation. And having these difficult conversations has been really challenging. And I will say our work has been very, very slow. Like we have not been able to get a policy finalized in 6 months, but it's necessarily slow. People want this back and forth. They want to be talking to each other. So my biggest lessons learned from this is when we are doing work with diverse stakeholders, competing interests, but all often working towards some common ground. It's like finding out what is the common ground, allowing people the space to talk to one another directly, raise their challenges, even when it's there's discomfort, and trying to pull out where there's opportunities for collaboration. And sometimes some of these groups are going to have to give in, right? That includes MPD. Like they have to give in sometimes. That includes the head of nursing or the head of trauma. They have to give in if we're going to make any progress. And this whole process has driven home the importance of collaboration, transparency. Bringing everybody together meant that everyone had to be honest about what was going on. And that transparency led to accountability. Okay, we all created this policy. We created this form. Okay, we're going to take it back to our patrol. We're going to make sure they're trained. We're going to make sure that this is being implemented. And so I think that by doing it this way, we were able to manage the diverse stakeholder perspectives and needs and priorities. And it wasn't always pretty. It's not easy. It's not like, oh, now we've checked the box and we've solved the problem. Like it's never going to be that way, but this is a different way of doing things when you have so many different stakeholders together for issues that are really, impactful. Like this is real for the people that are getting shot and the family members that are losing their loved ones. Like this is something that is really, really important for people and communities, especially in the DC area where we are. And so making sure that everybody feels like they're a part of this process and not just impacted randomly by some policy that's thrown at them is important for us to be able to make progress.
Yeah. That co-creation aspect of it, I think, is often unspoken. So I do appreciate you kind of shedding light in terms of the scope, in terms of having so much voices at the same table, as well as the time commitment that comes with that. So me hearing you saying that there's these reoccurring monthly meetings with representatives and it's just taking time, it sits well with me, because thinking of other initiatives where folks kind of want to just wave a magic wand and say, everybody's at the table, we came up with an agreement, do it and run with it. It's like, it can't work like that. And in fact, when you rush processes and you don't have everyone at the table and take your time, you actually cause more harm often than not than what you set and intended out to do from the start. So I think that's definitely a key takeaway here, is that there's going to be a lot of resources in terms of time commitments, coming up with those policies, back and forth, standards, SOPs, going back and forth, seeing kind of what that looks like. And I say that in reference to some work that I've been involved with where there was like this top-down initiative at the state level, and all these different agencies that didn't always communicate now had to be at the same table and agree to this initiative, essentially. And I don't think there were routine meetings. I don't think there were communications down to the most lower level staff for those organizations that had hierarchy systems. And because of that, in the evaluation, on the process evaluation side, what we tended to see, and I'm purposely leaving out the specific name of kind of where this took place, what we saw was that individuals did not buy into the outcomes that were set forth collectively. They were like, oh, that's education. That's not our outcome. That's criminal justice. That's not our thing. But what you described is time, intentionality, full-on buy-in, continuous kind of bringing everyone to the table so that there's a shared vision taking place.
Yeah. And again, that takes time, but like trust, I think one part I didn't mention specifically is the trust that's involved, because most of the people, for example, here when they walked in to the first meeting, they were on edge about the police being in the room just because of all of the history involved and the power dynamics that come into play. Like there's also the trust that happens. It took time. And it's little things, right? Like we had food for every single meeting, and you'd see people kind of talking over food that typically wouldn't be talking to each other. And so it's also time consuming because it's relationship building, and these are like people's lives and their liveliness. And so being thoughtful and mindful is something that is important. And to your point, it's not been the way that things have been done in the past. And that's sometimes where we see things falling apart in practice. So we'll develop the policies and the research, but when they are put into the place or the organization or the part of the initiative, then it's becomes difficult for it to stick if you don't actually put the time up front.
Yeah. I love that. Not to take us down too much down the trust aspect, but I think that's so vital, even from not even just the partners who are at the table, different agencies, but even the research team. Because I can think of plenty of times, like I've done work with, the courts, corrections, police, and the whole nine, where I've walked into a police room and even I might be like, oh man, like, I don't know, like we kind of got to break the ice type of thing. And I have a systems NYPD officer, the whole nine, but it's just still kind of that weird moment. And then once you kind of break bread in some type of format, so I love kind of talking about, hey, we have food and we eat together type of thing. It can quickly change your dynamic, and you build that rapport, that trust, and the whole nine. That's pretty cool. I do have a final question here for you, which is kind of a catch-all, which is there anything that you'd like to make note of in terms of evaluation, research more broadly for our students, the audience here today, just based off of your experience, your expertise?
Yeah, I think I would just drive home the same thing that I've kind of been saying, is like thinking about time and being intentional about what you're doing. So a lot of times there will be like money and resources and emphasis focused on, for example, outcomes evaluation. So like, just tell us if this thing works. Like just, measure the outcomes, get the data, and just tell us if it works. So just give us a little snapshot. But we don't want to take those shortcuts, especially in the work that we do that impacts the lives of people so heavily, which is the importance of things like process evaluation, of community engagement, of like the trust building, of like having key influential partners involved, even if that means the leadership of the police department or the Department of Corrections or whoever it is that needs to be in the room, that you take the time to build the trust, build the relationships, do the process evaluation, make sure that you're looking at what's actually happening, and don't kind of shortchange the whole evaluation, because you don't want to just look at something and say, oh, this is working because, it looks like we had a reduction in police misconduct, but it wasn't actually like the program that did that. There was a whole law that was changed on the way you report police misconduct or something else, right? There could be unintended consequences, or you could be missing things if you're not always looking at the whole picture. And so to be very thoughtful and mindful that research is time consuming and resource heavy. And so take the time to do the work so that we do have rigorous and comprehensive and well done process and outcomes evaluations. And then the last piece I'll say is also this work is often rooted in humanity. And so when we think about things like community wellness and community safety, remember to do this with that dignity and with the respect for the people that you're working with, the people that you're going to be impacting, and like like I mentioned, we always use food to do that because I think people like to eat, people like to laugh, and the sentiment there is that people are generally moving towards something that they think they are doing to improve humanity, improve community, improve whatever the thing is that they're studying. And so at the end of the day, it's important to remember that everybody's human, and we need to find that in people to come together as a group and community, and the way that we do our research.
Thank you. Thank you for that. I do want to definitely end on your voice. So the last thing I'll put out there is, how can we reach you? And thank you in advance for taking the time out of your day to just talk with us about all your work. I think we learned a lot from you today.
Well, thank you all for allowing me this space. I hope it was helpful. If you would like to reach me, feel free to send me an email. It's my name, cassandra.ramdath@georgetown.edu. And I'm also on LinkedIn, so feel free to connect with me there. And, I'm happy to take any calls, emails, chat with folks if they want to talk about research or anything else in general. So definitely feel free to reach out.